The following program is intended to educate the public on a variety of cosmetic procedures and is paid for by the participating doctors.
Hi, I'm John Collins. Welcome to a special edition of Body Beautiful. Our guest today is Dr. Vikki Petersen. She was just nominated for Gluten Free Doctor of the Year. Congratulations. She's the founder of Health Now Medical Center and the author of The Gluten Effect. She's also an ebook author as well. Dr. Petersen is committed to increasing awareness of gluten intolerance. Welcome, Dr. Vikki Petersen.
Thank you.
If people don't know anything about gluten, they're going to want to stick around today. This is an amazing conversation. Of course, before we get started, any advice we give you today, obviously consult your own physician. All right, Dr. Petersen, what's the connection between gluten and being overweight?
First of all, I think we should define the term, just in case people are new to it. So gluten is a protein found in the grains wheat, rye, and barley. And obesity is a huge problem in the United States. 2/3 of our population fit in that category. So the odds are that someone watching or someone who's near and dear to them fit into that category as well. And gluten is absolutely a culprit in obesity, which we're going to prove today. And it's my goal that by the end of the show, everyone watching will feel how important it is for themselves to figure out, are they gluten intolerant? And if they are, then they'll lose the pounds and save their life.
All right, so 2/3 of the population is overweight. All that's not due to gluten. So what are the symptoms if somebody's got a problem with gluten?
Well, there's a tremendous number of symptoms. Gluten is associated with over 300 symptoms and conditions.
Wow.
So anything from fatigue, migraines, thyroid disease, skin conditions, infertility, IBS, digestive problems. It actually goes on and on. It's a huge list. But
if somebody's on a diet,
yeah.
I know that, when I've ever tried to be on a diet, the biggest thing for me is just cravings. Does gluten have anything to do with that?
Oh my gosh, yes. It is the culprit.
Really?
Yeah, absolutely. So you hit it right on the head. So patients can, well, anybody, they don't have to be a patient, but they can be on a diet, and the downfall is the cravings. So they can kind of push them aside for a while and, not listen to them for a while, but eventually in they come, and that's the end of it. And maybe you've had the experience where you eat a meal, it was a decent meal, it should have lasted you.
Especially pasta, I find, for me.
Yeah, for you, okay,
yeah.
And that's a gluten-containing food, so that's interesting. And so, you eat the meal and you go, that should have been enough, but then, the cravings start. And it's always that sugar or simple carbohydrate, like the pasta that you mentioned. It's almost like having a monkey on your shoulder and it's going, sugar, sugar, or starch, starch, and it won't let up until you give in. And then you give in, and of course it's the wrong food, and there goes your diet. So
gluten is causing that?
yeah, absolutely. And here's why, and here's the simplicity. So the two major causes of cravings, first of all, is digestive. So when you eat, the food goes in your mouth, goes to your stomach, and then it's supposed to go to your intestines, be broken down, and then delivered to all your cells.
Right.
You have 10 trillion cells.
Makes
so
sense.
Fair
10
bit.
trillion?
fair bit to feed, right?
Wow.
Yeah. And so if those cells don't get the nutrition, right, how do they feel? They're still hungry. And that's where the cravings come from. Your cells are trying to tell you, I saw it go in your mouth, and I saw it go in the stomach, but we didn't get it.
So gluten interferes with that digestive process. That's
exactly.
Thing one. Okay.
Gluten is the culprit where it's not allowing your food to turn into good fuel, because that's why we eat ultimately, is to fuel our cells so they can do their job and be healthy.
So the fuel isn't getting there, and I just keep getting hungrier and hungrier and hungrier.
Yeah, and because the cells are so hungry, they want you to feed them quickly. And so the things that go into your bloodstream quickly are sugar and simple carbs.
Ah.
So that's why it's not organic kale, they're not,
Yeah, no.
they're not yelling
nothing
for that.
Good, yeah.
Yeah, exactly. And then, so that's the answer for the digestive ones, of that I can't be satisfied. So of course there's no way you're going to lose weight.
But sometimes I'm feeling full, so I don't feel like I need to eat anymore, but something's going on in my head that I just want.
Yeah, well that full is like you actually ate enough and the stomach is full, but once again those cells aren't getting it.
Okay.
And the only way they can tell you is they want that quick fix. And that's why it's always the thing that will railroad in very fast, which is the sugar and the simple carbs. And so the real solution is not to say, I don't hear you cravings. It's to have them stop, because you've actually effectively and efficiently fed your cells, and so there's no more monkey you know, saying feed me, because the cravings are gone. So if you can imagine no cravings,
wow,
then it would be pretty easy to eat well.
I like that kind of a diet, no cravings. Now,
yeah,
there's also a chemical component to this too, right?
Yeah.
What's that side of the gluten problem?
It's very interesting. It's how gluten actually affects your brain. So if you're sensitive to gluten and you eat it, you can get what's called a chemical like morphine being produced.
Like gluten actually makes a morphine-like thing?
Truly, and it's called gluteomorphine.
So it really is a morphine
That's the technical
compound. Wow.
name. So they put gluten and morphine together, and so of course you get this euphoria. And I think it's really where the concept of pleasure foods came from, or comfort foods. You know, that like, oh, I feel so good. You know, I just had that, you know, stack of pancakes or that big brownie, and you feel great. But then, as that food starts coming out of your system, so does the morphine, and then what do you get? The I want more.
Give me some more of that. Yeah.
Give me some more of that, because you're truly addicted. So for some people, they feel like they'll say, I'm addicted to sugar, or I'm addicted to carbs. They truly are.
They actually know it on a visceral level.
They do, they do. And these are the people, when you talk about changing their diet, they get a little, you know, they get a little freaked out. And it's not hard to fix. I mean, you have to get off the gluten, but you have to do it with a clinician who can really hold your hand through it. Not hard, but then when that monkey's off your back and you truly don't have that addiction, then it's easy.
This is incredible. It's actually a morphine that gluten is creating, actually addicting you to those carbs and those gluten-containing substances.
Exactly.
That is actually, that's like the headline. We should have started with that. That's amazing. So
yeah,
there's a basic hunger mechanism. Your body isn't digesting well, and then there's also a real addiction mechanism here.
Exactly.
I think this is going to surprise a lot of people. Yeah. That's incredible. Now, the other thing that you say in the book is that gluten is the great masquerader. What do you mean by that? Gluten is the great masquerader.
It's fascinating. So because gluten is known to affect literally every system and organ in your body, I mean, from heart disease to cancer to thyroid disease to liver disease to joint disorders to skin, I mean, every system you can think of, gluten affects. It's called the great masquerader because you might say, if I was gluten intolerant, how might I feel? Well, there could be something, the truth, the factual answer is there could be something wrong with any part of your body, and it could be because of gluten.
It doesn't have to be, but it could be.
Right. So say you're depressed, and it's because of gluten, which that's a very strong correlation.
Really? Even depression?
Oh, very strong. Wow. Very strong. So someone is given the drug to treat their depression, but they're missing the fact that gluten is the underlying root cause. Or your thyroid disease, you're given a drug, but gluten is the underlying root cause. So imagine you could change your diet and get rid of these diseases for good. Like, that is a potential. Is
this one of the reasons that people don't specialize in gluten intolerance? There's just no drugs that help you out? You have to make a change in what you're doing?
Yeah, that's very well said. I mean, you know, the truth is we're in a very drug-oriented society, and there's not the quick pill that I can just give you and say, now you're treated. You know, that's not going to happen. And what we're talking about here is anywhere from 10 to 30% of the population falls in this category. This is not a small percentage. And what's even sadder is that 95 to 99% of the people suffering don't know it's a problem for them.
Wow. Huge. Huge.
Yeah.
So beyond just being overweight, it sounds like gluten can have a whole lot of other negative effects on your system. People are trying to cover it up with drug therapies, and
yeah.
What's the upshot there?
I mean, gluten increases your risk of death from all causes. Research.
Wow.
Fact.
Well, we got to take a break, but let's talk death even. So coming up, gluten can put your life at risk. But first, if you'd like to get a free health analysis from the doctors who pioneered the study of gluten, call right now, 408-733-0400. Obviously, they can't take everyone for free, but right now, the first 50 callers will get a free health analysis. Gluten can play such a strong role in creating poor health and obesity. It's smart to just rule that out while getting at the root cause of your health problems. You'll spend half an hour with a doctor at no charge. It's a chance to see if they can help you with your weight loss or health issues. 408-733-0400. We'll be right back with Dr. Vikki Petersen on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of KRON TV, its management, employees, or advisors.
Hi, I'm John Collins, and I'm with Dr. Vikki Petersen, author of The Gluten Effect. And again, any advice we give you today, obviously you want to consult your physician. Right before the break, we said gluten could actually kill you. I assume you mean shorten your life expectancy.
Absolutely, and there's a couple of key studies out that I really wanted to review. One was 2009, 30,000 people, so this was not a small study.
30,000 big, yeah.
Yeah, exactly. And what they found was that there was an increased risk of death from heart disease and cancer, which are our #1 and #2 killers in this country. And the increased risk was anywhere from 35 to 72%.
At a minimum 35% and up to almost 75.
Mm-hmm.
Wow, that's an incredible statistic.
Right, and this is our #1 and #2 killer. So because you are gluten intolerant. The next study looked at the fact that autoimmune disease, now autoimmune diseases as a whole, there's over 100 of them, and you know a lot of them: multiple sclerosis, rheumatoid arthritis, Alzheimer's, Sjogren's, lupus. There's a huge field of autoimmune disease.
Pretty big section of disease, yeah.
Yeah. But when you take them together as a whole, they're our third leading cause of death, which a lot of people don't realize.
Wow.
Now, this study showed that if you have celiac disease, which we'll define in a moment, you are 10 times more likely to have autoimmune disease.
Wow.
So now we have the #1, #2, and #3 leading causes of death vastly increase because you're gluten intolerant.
Wow. And mostly doctors just paper over these symptoms that are caused by gluten with drugs. So they never really get at this root cause.
We're treating the heart disease, we're treating the cancer, we're treating the autoimmune disease, but we're not treating gluten. And then gluten itself, celiac disease, which is a form of gluten intolerance, has increased 400% in the last 50 years.
Is that just, are we getting better at diagnosing that? Why is there such an increase?
That's a good question. Basically, we feel that it's because we're less healthy, actually.
Wow.
You know, it's our poor diet. Yeah, unfortunately.
Processed food.
Yeah, that's the root cause, absolutely. So, you know, what we have here is something that we really have to pay attention to. And I did want to define our terms as far as celiac disease and gluten sensitivity. So I use the term gluten intolerance. That's kind of the umbrella term. Celiac disease affects anywhere from 1 to 4% of the population. Gluten sensitivity, newer on the scene, the estimation is anywhere from 10 to 20, maybe up to 30% of the population. And the reason it's kind of vague is that research has just begun. You mentioned our book, The Gluten Effect. We were one of the first on the scene to say there is such a thing as gluten sensitivity.
Well, and your patients were telling you that. They were coming to you and saying, hey, it's more than what they're saying here. Now, celiac disease, they have pretty good testing for that. They can actually do biopsy in a different part of your intestines, and so they can nail that down. But how do you figure out if you're gluten intolerant?
That's a very good question. You have to test, and as you mentioned with the testing, there are blood tests for both, but they're not perfect. So you want to be tested for both celiac disease and gluten sensitivity, so you need to go to a doctor that realizes there is such a thing as gluten sensitivity. Yeah, or you're going to miss the boat. The other thing is the doctor really needs to appreciate the fact that the tests aren't perfect, so you want to back it up with a lifestyle change. Fortunately, as far as the tests not being perfect, they're still not perfect, but they've gotten a lot better in the last 1.5 to 2 years because a new lab has come on the scene. It's called Cyrex Labs, and they have a blood test that actually has markers for both, so one blood test and markers for both diseases, which is great, and they truly are leaders in the field. I have no vested interest in the company.
You don't own stock?
No.
Okay.
I wish I did, actually. But they've brought so much to this field, you know, because they also have other lab tests that look at what we call the secondary effects associated with gluten, which it's just very comprehensive. So they're on the scene, which is great. So you want to go to a doctor that can order you that type of test. And then the other fact is you have to appreciate that you also have to change your diet.
Now, you're too modest here, but I'm going to tell folks, before she wrote the book, people were not looking for a way to even test for gluten intolerance. They didn't even think it existed. So you you pioneered this to a large extent, and the laboratory work and stuff has kind of caught up with you. So that's kind of amazing.
Yeah, thank you. It's true. It all, you know, there's a synergy. I think there's a synergy that happens when something starts being obvious that it's there, and then there was more research being done on it, et cetera. But the dietary key is important that I want to bring up, because sometimes people say, well, I got off gluten for a week and I didn't notice much. You know, it's minimum 30 days, and you have to be perfect. You know, so you really have to know. You can go to our website to know all the hidden things. Like, you know, the other day somebody said, well, gluten can't be in a liquid, can it? It's like, yes, soy sauce, beer. You know.
Oh, beer. Oh, wait, I got to give up beer? Is there gluten-free beer?
There is.
Oh, okay.
Yeah.
I might have to give up beer. Okay.
Yeah, no, you're all right.
I'm all right.
But it's very important that you know that you have to back it up with the dietary change for 30 days because the tests aren't perfect. And then the other problem is some doctors actually, you know, it's not that easy to get tested. And I hear from people all over the world, it's my doctor won't test me, my doctor refuses to test me.
Doctors are refusing to actually test people? That we have to take a break, but we're going to talk about that in a minute. Coming up, why some doctors refuse to test their patients. But first, if you'd like to get a free health analysis from doctors who pioneered the study of gluten, call right now, 408-733-0400. Obviously, they can't take everybody for free, but right now, they're going to take the first 50 callers, and you'll get a free health analysis, because gluten can play such a strong role in creating poor health and even obesity. It's smart to just rule that out so you can actually get at the root of what's happening with your health problems. 408-733-0400. We're coming right back with Dr. Vikki Petersen on this special edition of Body Beautiful. Welcome back to the special edition of Body Beautiful. We're talking about gluten with the author of The Gluten Effect, Dr. Vikki Petersen. Now, why would some doctors just flat out refuse to test for gluten
I know,
intolerance?
it sounds a little unbelievable, but here's why. When we were trained as doctors, the model of celiac disease, which was originally discovered hundreds of years ago, the way the patient presented was very, very underweight, a lot of digestive pain, severe diarrhea. So you got to kind of get that drilled in your head. That's what a celiac patient looked like. Gluten sensitivity is new on the scene, so if doctors aren't current, they don't even know that it exists. And then they've got this dated model of what a celiac looks like.
So in their view, gluten intolerance equals celiac, which equals thin, which is not what the reality is out there.
Right. So a patient walks in who's even normal weight, let alone overweight, and 2/3 of our population is overweight. They go, gee, and I really think this might be a problem. And doctors go, no, I'm not going to test you. You're fat. You can't be gluten intolerant. Wow. I mean, I've heard that.
So you really need somebody who knows about this subject area.
Yeah.
You really have to have an expert in this subject area.
Oh, absolutely. You know, a good test is, have you heard of gluten sensitivity? You know,
just ask the question, right?
No, absolutely, absolutely. But a great research study came out, and it showed they followed people for 10 years, all different ages. 44% of them, this is just 2010, 44% of them at the time of diagnosis were overweight.
Wow.
Yeah, so that's the shift that needs to occur, and doctors are not there yet, which is why 95 to 99% of the people suffering do not know it. Their doctors are not finding it out, and that's something I'm committed to changing.
So there could be thousands of people right now watching this show. In all likelihood, thousands of people watching the show are gluten intolerant and just don't know it.
Exactly.
I know that we have a great before and after picture. One of your patients, Eric. Tell me about Eric a little bit.
Eric is great. He's lost over 100 pounds, and he is now running races and winning races in his age category.
Wow.
And I tell him he looks like his own son, which he truly does. I mean, if you didn't know it was the same guy, I mean, you'd really have to stare there a little bit to know. So this is not somebody who lost 100 pounds who needed to lose 250 pounds, you know? This is a guy that if he'd lost 90 still would have looked fantastic. He looks amazing, he feels amazing. He didn't just get rid of the gluten though, but he also really cleaned up his diet, you know, good healthy food.
So was he one of those guys that just had the cravings that we were talking about earlier?
Oh gosh. Yeah.
So that the chemical, the gluten, creates that morphine, which is just this addiction process in your brain.
Absolutely, and he was hungry all the time. And this was literally a guy, and I didn't know this until he did a little video for us, and he said he had tried everything, and he named off every diet plan you've ever heard of. And this is a guy, when he goes for it, you know,
wow.
Much like a gentleman here.
Yeah, Todd, I don't know Eric, but I do know Todd Scow, one of our producers here, and Todd went gluten-free and lost a bunch of weight. So Todd is a believer as well. You have a KRON 4 employee on your side. Let me tell folks how they can get a hold of your clinic. If you'd like to get a free health analysis from the doctors who basically pioneered the study of gluten, you can give them a call right now at 408-733-0400. Obviously, they can't take everybody for free, but right now, the first 50 callers will get a free health analysis. That's great that you're offering this. It's amazing. Gluten can play, like we've been saying, such a strong role in creating poor health and obesity. It's smart to just rule that out, to get at the root of what your health problem might actually be. So this is a half hour for free with a doctor just to see what Health Now Medical Center can do to help you. If you have a weight problem or persistent health problem, this could be the best half hour you invest in your health all year. 408-733-0400. We're coming right back with Dr. Vikki Petersen on Body Beautiful. Welcome back to this special edition of Body Beautiful. We've been lucky to have one of the world's foremost experts on gluten intolerance as the guest today, Dr. Vikki Petersen. And people come from all over the country and around the globe, in fact, to come to your clinic. So we're really lucky to have you with us just right here in our backyard in the Bay Area.
Thank you.
And so what is the least somebody needs to take away from this show? If you don't watch any, if they haven't watched anything so far, what could they watch? What do they need to hear right now?
Yeah, a good summary is if you're overweight, if you have any chronic health problems, meaning just things that are not being handled or you have to take a medication for them, then get tested thoroughly for gluten intolerance.
Thoroughly
so
tested,
that means a blood test for celiac disease and gluten sensitivity, and a 30-day gluten elimination diet. Once you've
That's key. That's
yes,
really key.
all three, so you really know for sure. Then if you find out you're intolerant, look at your family, because I guarantee you'll find others in your family that are that way as well, because it is a genetic problem. And then lastly, find a clinician who knows about this, because the reason we became a destination clinic are people coming from all over the world, all over the country, because they're not getting the help they need. And that's unfortunate, because you're trying so hard, but you don't have somebody backing you up to just kind of fill in those little pieces, and that's what we want to do. I mean, that's my goal, is to raise awareness and stop people suffering from things they don't even know is the cause of their problem. And
what's the, you had a really simple question, you just can ask your doctor to find out if you're going to the right doctor, and it is?
Yeah, do you know about gluten sensitivity?
that's too simple. That's the key to success here.
Yeah, such a litmus test.
So and again, just so people are aware, the gluten prevents you from absorbing the right nutrition, and it also creates a morphine-like drug in your brain to create a craving, an ongoing craving.
Right.
And so unlike the earlier impressions of gluten, it can cause you to be overweight.
Absolutely. Key item in overweight.
Key item in overweight, and a key item in the top 3 causes of death.
Right, heart disease, cancer, and autoimmune disease.
It's just, it's a fascinating read. If you want to learn more about gluten, pick up the book, The Gluten Effect. And for more information about the Health Now Medical Center, call 408-733-0400 or online at healthnowmedical.com. And right now, the first 50 callers are going to get a free health analysis. You can call and give the appointment to a friend or a family member you think might need it. You'll spend a half hour with a doctor at no charge to assess your health and weight goals. It's 408-733-0400. Thank you, Dr. Vikki Petersen, for coming in today. Come back and see us.
Thank you. It was great.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of KRON TV, its management, employees, or advisors.